Why does everybody feel labor pain so differently? You're thinking, if I smash my finger, everyone's going to put that as a 7 on the pain scale. Today, we're going to talk about how everybody feels it differently and what you can do moving forward about pain in your delivery. Now, I think it's really important to learn about pain during delivery from an expert. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience. I'm also the creator of the online prenatal class for couples, and I am not here to fearmonger you about pain during delivery. I'm just here to give you what I've seen, what the studies have shown, so that you can move forward during your pregnancy. And as a note, I've done more than labor and delivery. I worked for a pediatric clinic where I saw kids with broken bones. I worked nursing home where those patients were in a lot of pain, like a lot of pain. And I also did hospice. And so I've seen people in a variety of situations manage pain. And the first thing I want to talk about is pain tolerance. Now, I all the time would have patients who came in and they were like, I have the worst pain tolerance. And as I would watch them manage labor, I would be like, no, girl, you're doing really good. Or they would come in saying, I have amazing pain tolerance and I'm absolutely miserable. And I would think, I don't think pain tolerance is a thing, or at least yours isn't. Pain tolerance really varies. You might be able to handle the pain of an appendix rupturing really good, but then you come into labor and delivery and it's absolutely a mess. So don't think that pain tolerance is a thing. I know some of you that are watching are thinking, I have absolutely the worst pain tolerance. Labor is going to be the worst. And I'm here to tell you, I don't agree. So just take it as it comes. Okay, the first thing that can really affect how you feel pain during labor is your past. Now, some of you have had trauma, sexual trauma, trauma with a partner, just things that have gone on. And some of you might have trauma surrounding the hospital. Maybe somebody you loved was in the hospital and just seeing the IV makes you freak out. Now, of course, everybody is carrying some trauma around with them, and I would encourage you to get some counseling if you really feel like that trauma is affecting you. I had trauma surrounding getting on an airplane, and so I actually went to therapy to learn how to get on an airplane better because it was something that I really wanted to be able to manage on my own. However, when you're in the hospital, please share as much as you're willing to about your trauma. Don't feel weird saying, hey, I've had some sexual trauma in the past, and this is a lot for me. It really helps me to understand where you're coming from and how we can move forward together in a way that really works for you. And again, if seeing that IV just reminds you of your sick dad, tell me. I might have some dressing that I can put over it, or we could just maybe saline lock it for a little bit. If something in labor and delivery is really triggering you, please let us know. Please don't be embarrassed about it. Please don't think you're the only one who's ever said that. All of these things that I'm talking about are things that people have shared with me, and I think we really moved forward in a more positive delivery because they were willing to be vulnerable and share. You know, I wanted to mention one thing. A lot of people think that how they're feeling is how everyone is feeling. And I think that that can be true in vaginal exams. So some people think, well, everybody wants to limit vaginal exams. They're absolutely miserable, but there are people out there who would like more vaginal exams because they really want to know what's going on in their body, and it gives them some sense of control when they know the numbers. So the more you can give us about what you want, the better. Don't assume that everybody wants things the way you want it. It can really be different person to person. Okay, we mentioned your past. Your future could also be really freaking you out. The fact that you are going to be a mom, the fact that you might not have the most stable relationship or environment to bring this baby to, it is a lot. I always say that labor is sort of like a wedding and a major medical event combined into one, which is absolutely horrible, and I totally get it. Not only are you having all these big medical things happening, but you are also having a major life event in which your life will never be the same after you have that medical event. So if you feel like you don't have a supportive enough partner, if you feel like you don't have the things that you need to go home to, feel free to talk with your nurse. The hospital is full of resources for new parents, be it food, be it education, be it assistance. So talk with them if it's something that you could use some help with. We can always call in the social worker. That's their job. I really think that the future is one of the things that makes labor pain so different than other types of pain, and maybe why pain tolerance isn't a thing for me as a labor and delivery nurse. Okay, something that I think a lot of people don't believe in is that I think we all have different neurons. I once had a patient who didn't feel labor at all. She was 10 centimeters dilated, was just talking through the things. I was like, how did you prepare for birth, girl? You're doing so good. And she was like, absolutely nothing. I don't feel any pain going on right now. Maybe a little discomfort, maybe some cramping. And it honestly freaked me out a little bit. I was like, what is going on? She is not feeling anything. What are we doing here? And we delivered the baby. She did super, super well. And then all of a sudden I started to hear her like screaming from her room, and I went back in and she was actually dying from the afterbirth pain. So I have no idea how she made it entirely through labor without any real need for assistance for pain management. But then postpartum, we ended up giving her pain meds because she was absolutely dying from the post-birth pains. And that was just a testimony to me that we all have very different neurons, and you really can't compare what your neurons are saying to you to somebody else's. One thing I also want to mention is we can only take pain from somebody else's mouth. We can only take it from what they're saying. And I was always so interested when I would hear people talk about their birth on the phone after I had done a delivery with them. And they were saying, oh, it was hardly painful at all, even though just an hour before that, they were dying in agony. And I was like, interesting. So just because Tracy down the street said she had a painless birth doesn't mean that she actually did have a painless birth. That's just how she's remembering it. So I'm sure there are people out there who have a painless birth. I just have not seen very many of them. And I don't want you to think that that is a normal thing, even though I feel like people talk about it sort of frequently. Okay, one of the other things that can really affect you during birth is the baby's position. Now, if they're in something called OP, which is when the baby is looking out, normally during labor, we want the baby to be looking this way towards your body, not looking out of your belly. But if baby's OP, that means that their head sort of digs into your back and you can have just the world's worst back pain. And a lot of people have that back labor for hours and it's just miserable. It's really hard to sleep through. No position is comfortable. And so how the baby's position can really change how you feel birth. Now, if baby is engaged really well and comes out really quickly, a lot of times those are great deliveries where people don't need pain management because it's happening so quickly. But if baby's in here at kind of a wonky position and it's just taking them a while to slide into the right position, that's very different. So once again, we don't know exactly how baby is positioned in the womb, and you can never compare your birth experience with somebody down the streets because everybody is so different. Now, one of the things we learn as a nurse is to judge people's pain off of the pain scale. So we'll ask you 0 to 10, what is the pain at right now? 0 being absolutely no pain, 10 being the worst pain you can imagine, and people will rate it. And as a nurse, we learned that we have to take their rating as what their pain is. That's all we can do. So you need to know that as well. All we can do is take somebody's pain rating. It can't come off of how their face looks or how hard their contractions feel on their belly. It's really what the patient says. Caveat, I've had so many patients come in and they're just 1 to 2 centimeters just in early labor. And I ask, what is your pain scale? And they'll say a 10. And I would have a heart-to-heart conversation with them that they need to know that this pain is likely going to get worse, so they might need to adjust their pain scale a little bit. Now, I totally believe that it is the worst pain they have ever experienced, but you got to kind of adjust that pain scale when you know that it's probably going to get worse. Now, of course, there's different types of labor. Some of you are going to come in after laboring at home for a long time and then very quickly have your baby in the hospital, which is what I always aimed for and never had happen. Some of you are going to need to come in when your cervix is closed, thick, and high and have a really long induction, and that is totally different. You're going to be more tired. You're going to be more bored. It's just a long time of no sleep and just a lot of pain. And so comparing those two different types of labors and feeling like, well, Jenny didn't get an epidural, even though she went into labor mostly at home, quickly had the baby after she got to the hospital, versus Veronica, who had a 72-hour induction. Those are two very different labors. And of course, those two people are going to feel that pain very differently. Quick reminder that a lot of times in the hospital, the pain comes from boredom, how horrible our beds are, the position you need to lie in to get your baby on the monitor. And I know a lot of you are going to say, we don't need to have the baby on the monitor, but if you're choosing to have your baby monitored, sometimes you have to be in a certain position in order for us to monitor the baby. And sometimes, I will totally agree, that position just sucks. And if that's you, again, another reason why we feel labor pain differently. Now, finally, your preparation definitely plays into this. I just had a viral video with a girl saying we need to normalize epidurals. And I thought epidurals are pretty normal in the United States, at least. The majority of patients get an epidural. However, I don't think the majority come in thinking they're going to want an epidural, but ultimately have not prepared in any way for natural pain management options. I think that part of birth pain comes from being scared about what's going on. It's important to remember that birth pain is not scary. It is your body's way to push that baby out before your uterus actually explodes. Now compare that to the pain of a broken bone or your appendix rupturing. That is really different. Those pains are to tell you you need to get something done because your body's going to be a mess if you don't. But there is the scary thing of what's going on. I don't know what they're doing. I don't know which side to put on of the gown. I don't know why they're collecting my urine in the toilet. I don't know why the nurses all run in the room when the baby's heart rate goes down. Is everything okay? So understanding the hospital can be really helpful. And I tell you that all of those scenarios are covered in the online prenatal class for couples, because I think the more we kind of pile on you during labor and delivery that you just don't understand, the worse it can be. Now, I wish labor and delivery nurses had time to explain all these different things, but when you come in with a basic foundation of knowledge, those nurses are really able to tailor their education towards what's happening to you, instead of this is the way you put the gown on, or this is why we need the gown to open up in the back. So I 100% recommend that everyone get prepared in a full prenatal class. Now you're going to say, Hillary, I'm here and I'm watching these videos and I absolutely love that you're here. Please give me a follow so we can hang out for the rest of your pregnancy. And of course, like this video because it tells more people to enjoy this high quality pregnancy information. But it is so easy to cherry pick what you are learning about online. You might not be learning about forceps. You might not be learning about common interventions. You might totally skip C-sections because you think you're not going to have one, but the chances of you needing a C-section or an induction aren't low. You need to learn about those things so that you're prepared for whatever type of birth you end up having. So come join me in the online prenatal class for couples. I always say it's the easy way to get prepared for birth. I created it as an all-in-one birth class. It has a section on natural pain management. It has one on provider communication if you feel like you're not communicating well with your provider. It even can have a breastfeeding bonus video. So come join me in there. I would absolutely love to see you. Okay, if you've already had your baby, what would you rank it on the pain scale? Does this change how you look at labor pains? I would love to know. Please tell me in the comments. And don't miss all my other videos that I think you'll find really helpful as well.